Okay, 7:47 on this Thursday morning Newswatch, and my pleasure to welcome to the show this morning Congressman Michael Arcuri, representing New York's 24th District, a blue dog Democrat. And boy, we've heard that term a lot. Congressman, thank you for coming on with us this morning.
Thanks for having me, Dave.
You know, this has been a very interesting couple of days to watch on the Hill as we see this group of Democrats, including yourself and others, who are essentially saying we want to take a closer look at this health care plan and make some adjustments. What are the key points that you bring to the table that you're concerned about with this reform?
Well, one point I want to make, and while I happen to be a blue dog Democrat, not all the blue dog Democrats agree on every point. For instance, I happen to be, a strong supporter of the public option, and I don't support a trigger. I think that the public option should happen automatically, which isn't the same as some of my blue dog colleagues. However, we are in agreement with respect to the fact that we want to make sure that this is deficit neutral. That is, that it isn't going to cost any money. We're not going to have to borrow any money for it, and that the cost of this thing is reasonable, and that it doesn't fall on the shoulders of small business. And that, to me, is very important. Look, I think that it's absolutely necessary to have universal health care. I am 100% behind it. But I think, we owe it to our constituents to have the very best plan that we can. And, President Obama said exactly the same thing. And, if it takes a little longer, so be it. But, I want to make sure that when I come home, I have, first of all, the final plan, that I have an opportunity to really look at it, to go through it really well. Because, every time I read the bill, we find something else in it that either we didn't know about or that there are two different interpretations of. So from my perspective, I'm glad that we're starting to work toward getting this thing less onerous on small business, less on the shoulders of small business, that we get the payments spread out a little better, and then we get it deficit neutral.
With that in mind, and so I understand, would this be a public insurance plan that would compete with private insurers? Is that what you
Yeah, I mean, competition is critical. Now, some of the things that the compromise that they came up with yesterday, it has, a public option that is not as robust as I would have liked it. However, what is critical here? I mean, what ultimately, and again, this is one of three plans that we have just in the House. The Senate's probably going to have a couple more. We're going to have to meld these into one plan. But what we need is to have competition among the insurance companies, and that way we can bring the cost down to the consumer and give the consumer the ability to choose from a series of different plans, whereby instead of the consumer looking to find the best plan, it's the providers that are competing to have the best price for the consumer.
Now, you understand this obviously in the Ithaca area, a much more progressive Democratic area, and just yesterday the Congressional Progressive Caucus saying we don't like this agreement that came out of the committee yesterday. How do you respond to progressive Democrats who say they want more than what is being looked at right now?
Well, look, our district, the 24th District, is a microcosm of what we deal with in Congress. We have, real progressives in our district, and we have ultra-conservatives in our district, and everything in between. Even the Republicans in our district are, Rockefeller Republicans. So, obviously we have to try to find a middle ground that everybody is a little bit unhappy. Now, there's still a lot of blue dogs that are unhappy with this. There's still a lot of progressives that are unhappy. Now, from my days as being a DA, I used to find that when you get to a deal where both sides are unhappy with it, you probably have, a good starting point in terms of negotiation. I think, we're certainly not at the end. We're in the midst of negotiation. We're working on this thing. We are going to try to have the very best plan with the strongest public option that we can that is not on the shoulders of small business. Those are my priorities. Look, it's not perfect. This isn't rocket science where everything is precise. This is, trying to find the best that we can do. At the same time, New York's hospitals work on the smallest profit margin of any hospitals in the country. Actually, we're 49 out of 50. So we need to make sure that we're doing this in such a way that allows for our rural hospitals to continue to be able to compete and continue to attract doctors. So we have, a real unique situation where we are in terms of upstate New York, in terms of continuing to attract doctors for our rural healthcare systems.
Which is interesting because that's exactly what a lot of southern states are dealing with as well. So we are a microcosm of other parts of the country when it comes to that. By the way, I have to tell you, Congressman, that if you don't make if people aren't happy on both sides, you probably have a good middle point. That is exactly what I was thinking yesterday when I was watching this all happen on television. That's really actually a very good point because that means something. Every side is getting something they want out of it.
Right. And just to give you an idea, Dave. Look, I mean, we're trying to find the exact specific statistics. To give you an idea, the Energy and Commerce Committee says that there are 71,000 people in the 24th Congressional District that don't have insurance. New York State says there's 130,000 people in the 24th Congressional District that don't have insurance. It's so hard to get exact figures of everything. And, we're trying to really, and I have to tell you, that's why one of the reasons that I said, hey, look, we're moving way too fast on this. Most of the people in the district, the vast majority, say, let's slow it down. Look, this thing isn't going to take effect until 2013. So what's 4 or 5 more weeks if we have an opportunity to get it better than we already had it? So that's what I'm working on, and I'm looking forward to, being down in the Ithaca area, and I'm sure I'll hear, but what I think is important is I want to hear, real good criticism in terms, not people shouting and yelling, because that doesn't do any good. What I need to hear is good, constructive criticism as to how we can make this bill better. That's what I'm looking for, and that's what we intend to give input back on when we get back here in September.
Yeah, so Congressman, would you agree that the August break is going to be a chance really to digest the packages that are out there and get what the feeling is of your district?
Absolutely, and to read the final draft that's going to come out of the House, and actually there'll be 3 bills coming out of the House of Representatives. Right. But there are some parts of it that I think that we're going to agree with, and there's some parts that I'm going to be dead set against. I have to try to get find out what is best for the district, and in the whole district, not just Tompkins County, not just Oneida and Herkimer County, not just Cortland County, but all of the 24th district. That's 11 counties, so that's not an easy task. But that's why I'll be traveling around trying to get some real input from everybody.
And not to get too complicated with it, but what are some of the things you're dead set against? What would be deal breakers for you?
A loss of a public option would be a deal breaker. I mean, I think a public option is critical. I think we have to have it. If the public option were out, that would be a deal breaker. If there were some kind of trigger mechanism in it, that would be a deal. In other words, what they talk about is a trigger mechanism before the public option could kick in. That would be a deal breaker. Too much, cost on the shoulders of small business, that would be a deal breaker for me. So, those were a couple of the things that I think, are deal breakers. I mean, if it puts our hospitals at a huge disadvantage, obviously that's a deal breaker.
And finally, this has become such a big issue and we're talking 1/6 of the nation's economy that we're impacting if we make changes to healthcare reform. Is this going to be a factor for President Obama for his 2012 reelection and, frankly, for you in your 2010 reelection? Is this sort of the issue you think that's going to structure how the campaigns go over the next few years?
I don't know if it's the issue. I think it's certainly one of the issues, but I think America's watching. I think, we ran as Democrats on the platform of being leaders, of not being afraid of change. But, America doesn't necessarily want change, too rapidly. I think, we need to definitely make sure that we're doing this in a thoughtful way. And I think that's what America wants. That's what I see. They want change, but they want thoughtful change, and they want to make sure we're not just doing it for the sake of doing it, but we're doing it because it's going to make things better. And, and I hear that a lot from seniors. Seniors are going to not really be impacted significantly by the changes here. They're going to continue to have Medicare. In fact, theirs will probably be better off because we're probably going to make Medicare Part D better. We're going to shrink that donut hole up so that the cost of health care for them is small. But, they're hearing a lot of things in the media that are unfair and, get them very concerned. So we need to make sure we're out there explaining to everyone, hey, look, this is not going to change. If you're a senior and you like your Medicare plan, you're going to continue to get your Medicare plan. That's not going to change.
And one last question for you. Special interest groups, obviously the health insurance agent groups. How do you assure that they're not going to influence decisions?
Well, look, we have a lot of insurance companies in our district. So those are jobs for people, that we know, for our neighbors, for people, that live down the street. So obviously it's not so much the healthcare industry that's influencing it, it's the jobs that also exist in our district. We need to make sure that that's a balance as well. Obviously, we balance that against the needs of the hospital, but most of all, we can't forget who this is all about. This is about the consumers. This is about all Americans, not just the Americans who don't have health care, but don't forget what our promise was. Our promise was not to just give health care to all Americans, but to make the health care system better. And we have to do that because this is going to raise the cost from 17% that it costs the country now to maybe 22% in 10 years. We cannot afford that. So health care is about all of America, not just the people without insurance.
It's an incredible time, an incredible thing to watch happen. Really, what will be American history being made as we go through the next several months and probably next year or two on this. Congressman Michael Arcuri, representing the 24th District, a Blue Dog Democrat. I like that name. I don't know why, but I like that. I think it's cool. Congressman Arcuri, thank you so much for being on with us this morning.
Thanks, Dave. Thanks for having me.
All right, 7:57 on the Morning News Watch. Congressman, thank you.